Okay. Okay. Well, thank you, everybody. Yeah, I know Ramon, working with him on some of his honors college work, and I know Juan from doing some of his Las Ganas or his Las Ganas research with me in my lab. So it's really nice to be here. If people are part of Lattice Leaders, then you might have already heard some of this on Saturday when I when I spoke to that group in the morning. Um, so I, I kind of got a sense of what do people usually talk about in these things, and what I like to talk about is like, and I can change it as you want, my trajectory and how things were not always easy, along the way to kind of get to where I am currently, which is as a professor in kinesiology and nutrition at UIC. Back when I was in college, so I went to Loyola University, and I didn't even know what I wanted to do with my life. I didn't declare a major until like I was like second semester sophomore year when I declared a major because I had no idea what I wanted to do. Um, and I had some people telling me like, are you crazy? Like you haven't declared yet. And I had other people saying like, it's okay, because a lot of people change majors anyway. So you get different feedback and you got to figure out, okay, which ones am I going to pay attention to and which ones am I just going to kind of leave out there? And I found psychology in that I had helped a friend who was going through like a bad breakup. He had broken up with his girlfriend, and so I was like, the sounding board, that person who listened to him, and I was able to help him out a decent amount. And I just really liked that role of being able to help somebody in that way. So I became a psychology major, and I found what I really liked was social psychology, because social psychology is all about identity, how people in different groups interact with one another. There's a ton of social psychology research on, like racism and racial and ethnic identity. And so that fit in well with me. I'm Mexican American, but I'm pretty acculturated. And my mom is, roots in Germany and Sweden. My dad is Mexican, but I'll say Mexican American because he was born in Chicago. Mis abuelos are from Mexico. So my grandmother, my dad's mom, was the only grandparent that I knew. And she lived with us until I was 12. So we were all pretty tight with her. And so I think a lot of that is where my identity, I've always identified as Mexican American. Where that identity comes from, and it was always important to me. So then when I was in school and I was like, oh, wow, I could learn about identity formation and these different studies of social psychology, I really liked it. And I got involved with research. I didn't know it was a good idea to get involved in research, except the girl I was dating at the time was also a psych major, and she was assisting with research. And I was like, well, how do you know to do that? Or how do you do that? She said, oh, if you want to go to graduate school, you should consider try to assist with research. And I was like, okay, I guess I need to do that. So then I got some position, a different position, two different positions, and was able to do that. And it was cool to see research behind the scenes. So my guess is that, some of you or many of you will get that experience, and it's not the most glorious a lot of times, or maybe even the work that you're doing as an undergraduate, maybe a little bit more of like the grunt work, so to speak, but it's all necessary. And like I have done so much grunt work, related to research. Now I get the glory of like, I get to give presentations and, cite the co-authors and that kind of stuff. But I spent many an hour in front of a computer, like entering data. So I'm not saying because I did it this way, everyone should do it this way. No, but to say it's an important part of research. When we had some really big studies going on and people were entering and checking data, I would try to stress it might get boring at times and you might not always look forward to coming to the lab, but please remember, like, what you are doing is like central to my livelihood, so it might not be that important to you. Maybe it is, which would be great, but it's understandable, right? Like, it can be boring. But like data is my academic life. Data is my research life. So it is really valuable to me. And I brought you on board because I trust you, right? Like, I and so, not to put like so much pressure that somebody's like, oh my gosh, I can't mess up, but more in terms of like, no, we're all an important piece here. And if any one of the pieces is not performing, then it affects all of the other pieces, and we don't, perform at a high level, and we want to do that. Um, so I got to do that, but then I graduated, and so I wanted to go to graduate school, but I wasn't really sure what I wanted to do yet. So again, these questions of like, what do I want to do with my life? I was really into my studies. Like, I really wanted to get good grades. So when I was a senior, I was like, well, maybe I'll take the GRE, but I didn't want to take time away from studying in my classes. So I worked for a year, and over that year, I was like, well, I'll study for the GRE. And those of you on your way to medical school or something like that, these standardized tests are part of it. Although the GRE is being dropped as a requirement for a lot of programs. For example, kinesiology and nutrition at UIC, my department, you do not have to take the GRE for graduate school in my department. We have dropped it because of the numerous studies that say it does not predict success. And we know about the racial and ethnic biases that are in there. All right, that said, if you're on your way to medical school, you have no choice but to take the MCAT. So you can fight the system in some way, but probably going to have to take it and do well for medical school. But it takes time, right? Like it takes time to study and put the effort into that. So I worked for a year, and I worked with kids who were wards of the state, kids in DCFS in a group home. And that was really hard. Like, all of the kids who lived in the house had been abused physically or sexually, physically, sexually, verbally, and or neglected. Like, there was this one boy who he was 15, and when he was taken out of his home, and he was neglected. He hadn't been abused, but for like a couple years, he had been working at the corner store. Like, his mom just wasn't around. His dad had left early. So, and he's like the coolest kid. I've actually Googled him like since I left there to see if I could find him, like just praying he was able to find success in life, that kind of stuff. So that was really hard job mentally, just taxing. Yeah, I'm focusing on myself. Like, their lives were like incredibly difficult. That I could talk about that some other time. But so I was like, I want to go back to school, right? And so I ended up in kinesiology, but not because I like love kinesiology. What I do is like exercise psychology. So it's about in short, why do people exercise? Why do people not exercise? How could we use these theories of health behavior to help people exercise more? And then when they do exercise regularly, what are the mental health, cognitive benefits that come from that? So I really enjoy the work that I do. But so I got into a master's program, and once again, I was like, I don't know what I want to do with my life. Worst thing that happens, I had a fellowship my first year, an assistantship my second year, so I didn't have to pay tuition. So I was like, okay, um, this is not bad. I leave it after 2 years if I need to, and I have a master's degree. That's not so bad. But I actually ended up really liking what I was doing. So a lot of what I say is like, you create opportunities for yourself, right? You take advantage of things like this group. You get to know other people. You network here. It helps you to network out there, because a lot of life is who you know, not always what you know. And historically, when it comes to these kinds of things, Latinos don't have those same connections. So you are already in a good place that you are creating these connections. It's not coincidence, these things that will come to you because you have put the time in and taken advantage of these kinds of opportunities. But I really liked the work that I was doing. So I went on stayed. This was in Urbana-Champaign for my PhD. And I wanted to do work with Latinos, physical activity and health. And I'll say my advisor let me. Um, he could have said, no, we don't do work with Latinos, because there was no work with Latinos at the time. And he said, no, you can do this, but if you want to forge this path, you're going to have to create it, because I haven't done anything with Latinos. And so I did that. Right. Like when I say I take pride in the work that I did, but I also understand that it was a result of many, many people, especially community members in Champaign-Urbana, right? So I had some connections there. And then they would help connect me with other people who were working with Latinos in the area. And then I would go and I'd set up meetings with them. And, despite my appearance, I have, the Latin surname that helps me. So I would send an email to set up a meeting, right? And then when they see the topic and what I'm interested in, then I would go for the meeting. And a lot of times they'd like, maybe I'm exaggerating, but they'd look past me and be like, wait, who? Oh, you're him. I said, yeah, I'm David Marquez, or, David. And but then I would talk to them and then they'd say, oh, you should. And then that trust builds, right? I just gave a talk in the past hour, about like different cultural values amongst Latinos, and that personalismo, right? That like getting to know people, and then you gain that trust and you're okay with it. Then I found that a lot with community-based organizations. And so my work takes place in communities. So I have to do this. I've always thought I was more introverted. I have been more introverted growing up, but I would force myself. I'm like, hey, if I want to do this work, I got to do these meetings. And I'd be anxious before every single meeting. Yet you get into it, you forget about your anxiety, and you go on. And you find, oh, that wasn't so bad. Part of my story too is that I have suffered from anxiety throughout my life. Okay. And it doesn't mean you can't be successful. And the more you talk about mental health, the more you realize how prevalent it is: depression, anxiety, and other forms of mental illness. And so I have made it here as somebody who suffers from anxiety, and I share that. Because there's a lot of us that do. So I bring that up because I would go to these meetings. I was so nervous. Like, who am I at the time? I'm like, I'm just a graduate student. I'm like, and I don't even look Latino. And so I'm trying to build trust. One of the things I've found out in life too, like if you have conviction in your heart about who you are, that comes out to people. Okay. So people might be skeptical. Like I know they were skeptical of me at first. All right, who's this guy? Like, wait, what's this research he wants to do? I'm not fully bilingual yet. I can speak Spanish. I'm not fully bilingual. But at the time, my Spanish was even worse, or even like less. And so they'd be like, oh, this is like a white guy who can't even speak Spanish. Is he just trying to take advantage of his Hispanic, name or stuff like that? Okay, fine. But I know who I am. I know who I was. And with time, with maturity, with success in different things, this has built in me over the years. But I have conviction now, right? Like I know what I'm about. I know what I'm trying to do. And I feel it's not an arrogance. Like I don't walk into buildings, like rooms and meetings and stuff like, don't you know who I am? Not like that, but I'm modest in that I'm not trying to be something I'm not, but I know who I am. And so I want that to come through in my work. Hopefully, when you have patients in the future, and especially Latino patients, they will be better able to immediate off the bat bond with you than somebody else. And especially if you're speaking Spanish and they're speaking Spanish, right? So though all of those things matter. And then when you have conviction about who you are and what you're trying to do and how you're trying to help people attain better health, that's going to come through, right? And if you're fake about it, many times people can see through that, right? So I do research for most of my time. And what's the coolest thing about having a PhD and doing research is that we get to decide what we want to study, right? So I want to study the physical activity and health of older Latinos. Nobody told me to do that. It's what I want to study, and I do. Now, I have to write grant proposals and I have to get my research funded. So if nobody wanted to fund my work, then I would have to change what I was doing. But a lot of my work has focused on a dance program, a Latin dance program. It's a form of physical activity that's more fun for a lot of people versus like traditional exercise. So we have found that older Latinos want to dance, don't really have the opportunity. So when there is the opportunity, they want to do it. It increases their physical activity. It can increase aspects of their cognition, like memory. They have fun doing it. They meet new people. They meet new friends. And it's a culturally relevant form of physical activity. So, as you go on, maybe you find that, hey, I've always had intentions to be an MD, but maybe I'll go this PhD route. Maybe you become an MD and you have that interest in research, and so you also do research as an MD, right? It's great, but the more opportunities, the more, am I trying to say? I don't think it's coincidence when things happen to people. Sometimes, yeah, coincidences happen. But other times, you create opportunities for yourself. And then you can never tell how, because you're in this association, you don't know exactly what's going to come from that in the future. But because you are in this, now you're going to meet people, right? You'll meet your peers, you'll meet speakers like myself. Maybe you follow up with people, and then it leads somewhere you never could have predicted. That happens to me all the time. I find that if you try to be a good person, right, not take advantage of people and situations and funding and stuff like that, if you try to be a good person, you succeed at that, hopefully most of the time. You work hard and you do good work, people appreciate that, right? So I kind of feel like I don't consider, like, I'm gonna swear for a minute. I don't really swear a whole lot, but I don't consider myself an asshole. Um, I do consider some people I know assholes. But I feel like I'm more likely, like when I do work with somebody, I just try to be amenable. Like I try to work with them, right? So they're more likely to come back to me in the future than this other person because of how this person is acting. Not that that's at the core of who they are, but it's how they're acting. So you try to be a good person, you try to work hard. It's not always going to work out. Sometimes people are going to try to take advantage of that, and you have to be on the lookout and protect yourself sometimes. But those, I think, are keys to moving forward and doing good things. Last thing I'll say, because I feel I just been rambling. When I was in graduate school, I thought, I never want somebody to say, I never want a researcher to say, he's a really good guy, because that was usually followed by, but his research isn't really good, or his work isn't really good. And I've changed that over time to think, no, actually, more than anything, I want people to say that I'm a good guy who also does high quality research, right? They don't have to be mutually exclusive. Like if you're one, you can't be the other, right? I'm 45 now, so I'm middle aged, and I want people. Anyway, now I'm turning into like a therapy session, but so I've got like 5 minutes left for if you want to ask questions about trajectory, my research, whatever you want to ask about. I'm happy, and then you all can share my email address, and I'm happy to talk to people separately as well. Did you? So I see in the chat. Maybe there was another one too, but okay, no, yeah. Do you ever doubt your career path? Yes. So as you heard, I always had doubts about like, what is my career path going to be? And then, inferiority complex, like maybe I'm just not meant to do this. Actually, that was the strongest after my first few years at UIC. I was struggling. I wasn't getting grants. I wasn't applying for as many grants as I should have, but I wasn't getting a lot of grants. And when you're on the tenure track, you get a 3rd-year review, because tenure is usually 6 years, and then they decide if they want to keep you around. My 3rd year said, unless he gets more funding, he's at serious risk of not being recommended for promotion and tenure. And that hit me hard. I came back to Chicago. I'm married, and I was married at the time. We had one of our 2 kids at the time, or maybe both at the time. And I was like, oh my gosh, because I'm not performing well enough at my job, I might have to uproot my family, like, in a sense, because I was saying, like, because I failed, right? It actually gets me pretty teary-eyed and emotional. I doubted myself tremendously. I went through a period of depression as well, but I always had people supporting me. I always had my family, my wife, my mom, my dad as well, but especially my mom, and my graduate students. So my first PhD student, he's faculty at UIC now in kinesiology, Dr. Eduardo Bustamante. Him and my second graduate student, who is now faculty at Urbana-Champaign, now she's Dr. Susie Aguinaga, they always supported me. They were like, we're going to get this. They call me doc. We're going to get this, doc. Like, no, it's all right. Like, we're going to get this funding. And somebody helped me get a plan for what I wanted to do. And the plan worked, like, for the most part. So I definitely doubted my path. I doubted myself. And somehow I was able to stick with it. I'm not really sure how. And I'm very happy right now with the research that we do, the people that I've had the opportunity to work with. So yeah, it happens. And support, having support, and not only people who are like, sometimes you also need the people that are going to be honest with you too. You don't want people like, oh, you can do it, but then they're like, I don't know if they can do it, like, no, like you want people that will tell you the truth also, so that you can help decide how things are going to move forward. So, the other one, like to do research, I'm afraid and shy to reach out. What do you recommend? What do you look for when you're looking for team members? Number one, I want to know, and I think that this would apply to my faculty peers as well. They want to know, let me put it in context of me. I want to know that the research I do fits you and your interests. Okay. So I could tell, like, somebody will say, like, oh, I went to your lab webpage. Oh, I did a Google search and I saw some of the articles that you do, and I am like this, and my interests, my goals are this, like, related to health. I'm Latino, Latina, Latinx, right? I have, health of my community is important. That connection, right? It shows you've done your research. So it could be whatever, like, if you're interested in doing, cellular research, then you find a researcher at UIC who's doing that, make that connection, right? Like, they want to know that you have an interest in what they're doing. I totally understand being shy and anxious about it. This is one of the great things about email, is that you don't have to, like, pick up the phone and call somebody. It doesn't have to be a Zoom off the bat. It doesn't have to be in person. Actually, it's probably best if it's email first. So then you can introduce yourself. You can say that you were, looking at different research at UIC, and their research really caught your eye. Or, this is funny, my daughter is 14, and whenever I say to her, like, what I would say, she's like, I would never say that. So it might not be exactly what I'm saying, but, like, it doesn't hurt to, like, flatter somebody, but not go over the top, right? So you say like, hey, I'm really interested in your research. This is who I am. This is what I do. Maybe if you attach your resume, if you think that's going to help show who you are and how that matches with what they do, and that you're interested in research opportunities. The other thing for summer is that there are official programs like you might be aware of, like HCOE has their SURPD, SURPHD or HPD. There's official summer research opportunities. And then there's also the SROP, Summer Research Opportunities Program, which is meant for Latinx and Black or African American undergraduates. So that's an opportunity as well. So I would say try to get up the courage to email. And it's an email. So that's, you know, the worst thing that they say is like, I'm not interested. And then you're like, okay, I go on to the next one. If you're interested, I can take a look at a draft email that you do and give you my ideas, my opinions on, you know, how I might revise that. But that's, yeah, bottom line, I want to know that this person would match up well. I hate to say a good fit because historically people of color didn't fit with what was going on, right? So I'm not saying that, but it kind of is fit. But in my case, like in my lab, I'm looking for Latinos, right? So if somebody doesn't speak, it varies year to year, semester to semester. But sometimes if somebody doesn't speak Spanish, then they're not a good fit for my lab. So find those that you're interested in that match your work or your interests, and then reach out via email. Okay, I know. So I know you have more to do, and I said I have 5:30. So I'm happy to end it here, or if there's another question, I can stick around too. So it's up to you. Feel free to tell me like, yeah, we're good. You're good. We'll keep going. And people can reach out to me via email as well.
Do you mind typing your email on the chat?
Oh yeah, sure. Yeah, sure. So it's my last name, Marquez, with my first initial D as in David, marquezd@uic.edu. I put it in the chat now. And the other thing too is I can help connect sometimes. Like I might not have spaces available for research, but I've been at UIC, it's crazy, 14 years now. So I've gotten to know people on East Campus and West Campus. I'm the current chair of the Chancellor's Committee on the Status of Latinos. And so through that, I've been able to do some great networking as well. So if I can't directly help, then maybe I can refer you to one of my colleagues, friends, peers, you know, whatever at UIC. Okay, cool. So thank you all very much for the opportunity, and I wish you the best, and get in contact if you would like.
Thank you.
Thank you so much. Take care.
Okay. All right. See you all. Bye-bye.
Thank you, Doc.
Okay, I guess we can move on to the next presenters. We have Mariana and Angie, which were previous e-board members here at LPMSA. Mariana was the president and Angie was the volunteer coordinator. They both graduated from UIC May of 2028 and are currently research coordinators at different hospitals. So let's give them a welcome and you can present.
Okay, hi guys, my name is Mariana, and like Sonia said, I was president at LPMSA from 2017 to 2018, and then I was involved all 4 years of my undergrad career at UIC. So I will be, so a little bit about myself. I'm a clinical research coordinator at Northwestern, and the department that I work for is the dermatology department. more specifically, my emphasis, most of the studies that I manage are pediatric dermatology. So these are children that come to us with really severe conditions. Like you think of dermatology, you think you think skincare, you think beauty, but honestly, it's really more than that. It's children who come to us and they have severe eczema to the point that it affects their quality of life, and or children who have really advanced diseases like we'll go more into depth, but we'll go more into depth. But pretty much my area right now is just clinical research coordination. um Prior to that, I was a clinical research assistant at Rush, the Center for Alzheimer's Disease Center, and currently I am applying to medical school this cycle and will be taking the MCAT as well. Okay. So like I mentioned, I work with coordinating pediatric and adult dermatology studies. The main principal investigator is Dr. Amy Paller, and she is the chair of pediatric dermatology at Lurie Children's. So my position is a little bit of a hybrid where I was hired through Northwestern, but a lot of my work is with children. So I spend a lot of my time at Lurie's. And the studies that we work on are mainly clinical trials, meaning we are essentially testing new medications to treat these conditions listed here: atopic dermatology, psoriasis, and epidermolysis bullosa, which is it's a deadly epidermolysis bullosa is fatal. Children don't live past 5 years of age when they have this condition. And so we test a lot of medication on these children because most of the time, like, that's their last hope. They're not getting better with any other medication. So we try to get them on these trials and hopefully they improve. My day-to-day responsibilities as a clinical research coordinator are they really go from screening and assessing eligibility of children into these studies. So there's a clinic component where we have dermatology fellows who are seeing patients in clinic. And if they see any of these children with any of these conditions who are not getting better with their current regimens, then they will see if they're candidates for our studies. And if they are, they'll bring them into our clinical research unit, where then I will see them and we will go through a whole criteria to see if they're able to be eligible for any of these studies. Again, once these kids are eligible to participate in our studies, what will happen is the studies need to certain activities need to occur for a clinical trial to take place. So that involves study drug administration, which I will then coordinate with the pharmacy and make sure that they are ready with medication for a specific date. And so that takes a lot of coordination, a lot of organization. Again, we will have to coordinate with the research unit to make sure that there are nurses on staff that are able to see these patients, because there's certain things that I can't do because I'm not a licensed provider. So the nurses will be in charge of taking the vitals or administering the drug and so on. And then I guess my main role here, aside from seeing patients and making sure that they start the study and they complete it and they meet all kinds of activities through it all, is really maintaining that communication between the PI, the principal investigator, the pharmaceutical companies, also known as sponsors, and our regulatory department, which would be the IRB. And the IRB, like, I don't know if you guys are familiar with research, but it's the Institutional Review Board. And these people make sure that every activity that we're doing is done ethically and we're not violating any kind of rules. And so to me, I think that if you guys are graduating and you're looking for maybe something to do between you're taking any gap years or anything like that, but you feel that you need that clinical exposure, I believe that clinical research is the way to go, because you really do work with so many different people in the hospital. You work with nurses, you work with pharmacists. If your study requires the participant to have an EKG or an ECG, CAT scan before beginning the study, or if the study requires that the participant get some kind of biopsy, then you coordinate with all these different departments to make sure that the patient comes and these things are happening. And it also, you learn a lot about insurance and how it works. So sometimes it's really easy to see whether a medication is working or not with these studies, because it's either working or not, and you're able to see it right away. So what ends up happening is that once the medication is proven to be effective, what will happen is there's a period of time where the medication has to be approved by the FDA. And so in the meantime, medication is effective and children are really benefiting. What will happen is that the pharmaceutical company will provide the child with that medication up until it's approved by the FDA, and up until their insurance is able to cover that medication. So you work a lot with insurance companies, making sure that these kids are able to make that transfer from, okay, well, now the sponsor is done covering, how can we make it so that your insurance is able to cover this medication that's clearly working for you? So yeah, I guess like that's really my part. I don't know if you guys have any questions now, or we can wait until Angie is done with hers.
Can you guys hear me? I wasn't sure there were any questions. I couldn't see the chat, but we can definitely go over questions at the end.
Mhm.
But so my name is Angie. So I was part of LPMSA as a member of 2016-2017 school year. And then I was volunteer coordinator for the 2017-2018 school year. And during my time there, I also did the medical mission trip. So I know I worked a lot with Sonia when she first started. We got to do a lot of volunteering together. We got to go to, she went to the trip to Peru. I worked with Jamie on some volunteering stuff, and he was a member in LPMSA when I was there. So it's really nice to see you guys grow in leadership. So after my time at UIC, I took a little bit of a different route after getting my bachelor's and my minor in bio. I decided to get my master's of science in biology at Roosevelt University. I started the program going toward my MA, which is a master's of arts, but I decided that that just wasn't what I really wanted. And I looked at the master's of science program, and it was just in a semester extra, and it fit my timeline for medical school and what I was doing. So I decided to do that. And after graduating, literally I graduated on a Friday, and that following Monday, I started working at Larry Children's as a research coordinator. So right now my plans are to take the MCAT this summer, hoping to apply to medical school, and I want to be a pediatric surgeon. And I actually get to work as a clinical research coordinator in pediatric surgery. So what I do is a little bit different than Mariana. So what I do, our focus is on surgical outcomes research. So because we are in pediatric surgery, because like Mariana explained, IRB, they make sure that what we're doing is ethical. And there are some clinical trials that you can do with surgery, but for us, we focus on health outcomes, meaning that we don't try to alter their surgeries, but we look at how they are recovering and see if we can improve that to avoid them having opioids, or even having to reduce the amount of times that they come back with complications after surgery. So I work for the Department of Surgery at Larry Children's with the Division of Pediatric Surgery. My primary PI is Dr. Fasan Abdullah. If you Google him, you can see all the different research that he does that we do with him. So I work for his lab called the Pediatric Health Outcomes Research Group for Surgery, or FROGS for short. And right now we are actually doing a study using Fitbits, where we get to see how the kids are doing after surgery. So a lot of my responsibilities are like Mariana's, except that I get to actually consent and recruit patients and enroll them into our studies. And when I do that, I put a Fitbit on them. After consenting them, I put a Fitbit on them. and I monitor them for 21 days. So I monitor their heart rate and physical activity to see how they're recovering from their surgery, and just kind of trying to see if we can catch any complications prior to them having to be in the ER, so that we can let their surgeon know, and they can already kind of try to make these connections. So in the future, if we can put a Fitbit on every patient, we can say like, hey, you have very low activity. Maybe it's time to see your primary care doc or make an appointment, because we don't like, this isn't like a normal timeline for someone who's recovering from your surgery. So I see a lot of appendectomies, and pretty sure if you guys don't know what that is, it's just when your appendix becomes inflamed. It can either be perforated or just infected. So there's like complicated, uncomplicated. Uncomplicated would be where it's just inflamed and it just needs to be removed. And once it pops, it becomes more complicated and you spend a lot longer in a hospital trying to recover from that. And then we also work with pectus excavatum. Dr. Abdullah is actually it's like a world-renowned surgeon for this procedure. So what pectus excavatum is like, you have sunken chest, correct? Like we'll have patients with sunken chest and it looks like this, and literally just looks like concave in. And what Dr. Abdullah does is he'll put in a bar, and then once the bar is in, he'll like lift it, like twist it, and the chest you'll immediately see go up. So what we do is we also watch those kids have a longer recovery time. So we're definitely, and they experience a lot more pain and they're on a lot more opioids. So we definitely also monitor that in our surgery. It's really, really cool. I like to call it like braces for your chest, because after a few years, they remove the bar and the chest is no longer concave. And then I guess I know if you guys are interested in being like a clinical research coordinator, I know at Lurie, can't speak much for Northwestern, but at Lurie, we have a ladder where you can grow and go from a CRP1 to a lead. And for me, I'm a CRP2, but there's so much room for growth. And then you can also join the IRB, like Mariana mentioned, which they review our IRB applications when we submit them in order to be eligible to conduct a study in the hospital. So there are many opportunities there. And then some of my other responsibilities, I also do a lot of writing and editing for manuscripts for publication. We actually just had one published like 2 days ago, so it was really exciting. And I make sure, like Mariana mentioned, I keep all the regulatory documents up to date to make sure I don't have study sponsors, because we are sponsored directly with pediatric surgery with our division. So I just make sure that everything's up to date in case we get an audit, which is like, and what IRB comes, and they kind of like when a sponsor comes and looks at your studies to make sure you're doing everything correct. It's the same thing here, but for me, it would just be the IRB. And if this is something that you guys are really interested in, something that, like you're looking at this research and you're like, health outcomes, surgical outcomes research looks really interesting to me, we do have a student internship program at Lurie. Very similarly to what Dr. Marquez mentioned, we do require that you guys send us a brief statement in your resume or CV and just describe to us like your academic experience or any research relevant experience. And you guys will be able to participate. If we receive anything by the end of this week, we will probably start interviews early next week. So you will hear from us very soon, since COVID restrictions have just lifted. A few COVID restrictions were lifted at the hospital. We're very eager to start the program up again. In the past, we had a lot of students I've gotten to shadow in the OR on downtime, but I know like our interns get to go to the OR and see surgeries. They get to go follow a surgeon in clinic when we have the chance. And they also get to learn a lot of the other things like working with IRB. They coordinate patient recruitment. They get to interact with patients. They get to help us with data collection and data inventory. So I think it really is a very helpful program if you're looking to go into medical school or nursing school or PA school. But we'll definitely send this out to Jamie and Sonia to share with the rest of you, or you can take a picture now. And if you guys have any questions, just let us know.
Yeah, feel free to ask questions like to the chat or send them directly.
What was the process to become a clinical researcher like? Okay, so my path to getting there was a little different than Angie. So I started as a clinical research assistant at Rush in their Alzheimer's disease center. So I was also doing a lot of assisting there with the I would assist the coordinators there, and I would just follow the patients on their day of visits, make sure that they were getting to their um their CAT scan appointment on time, making sure that if there was an infusion that day, which is a drug administration, we don't do it, but the cancer center would do it. So making sure that they're getting there on time. And so I felt like not only did I want to be there with the patient, I also wanted to have more leadership, more, I wanted to do more. So I ended up looking for other positions that would deal with a different population. So I go from Alzheimer's, these are 60 plus patients, to young children as young as 6 months old. I went ahead and just applied directly on the hospital's website. If you just search clinical research, you'll get a ton of positions. What about you, Angie?
So for me, like it was different. So like I mentioned, I went on to graduate school. So in graduate school, I did do some research for part of my like thesis when I graduated. And I think that was also really helpful. I also got to do research at UIC through Lattice with Mitzi Ramos, Dr. Ramos. And the work that I did with her actually was highlighted during my interview at Larry. So once it was like, I think I interviewed 2 months before I started. So it was like October. And I knew I was graduating in December for my master's program, and I wasn't going to apply to med school yet, of course. And I knew that I wanted to do something in research. I knew that I wanted to be in pediatrics. So for me, I did the same as Mariana. I went on different hospital websites, especially Larry. I know I want to work with kids. I want to work in pediatrics. And I knew I wanted to do general surgery, which is what we do in my department. And I decided that I would apply, and I got very lucky and heard back, and that's kind of how I did it. But I did have a lot of research experience already with and I'm sure it's similar to Mariana. Like she had a lot of research experience from what I know of. So I think that also really helped me get the position because I didn't start as an assistant. I started right off the bat as a coordinator.
And also, I just wanted to highlight, I have another friend who is also a clinical research coordinator at Northwestern in the cardiology department. And when she applied, she didn't have any kind of research experience. So honestly, like, don't be afraid. If you see a position that you feel you would like to explore more, feel free to send out your resume. You never know. Just communicate exactly what you want out of the department. So I know Angie, she wanted to be able to publish, and so highlight that, because it's very easy for you to get a position, but maybe you're not getting much out of it. Think about it. You have 2 years, right? And then you want to apply to medical school and you want to have something to show for it. So as just go ahead and see what departments or kind of research you're interested in.
Yeah, I have to agree with her. I know when I started at Larry, my manager told us how lucky we are in pediatric surgery, because unless you're very verbal about it, a lot of departments won't actually like come up to you and be like, hey, do you want to write a manuscript and be published? It's you have to take a lot of initiative when it comes to that. And that's definitely what I had to do. And I got very lucky with my team, to be honest. They're very friendly and willing to let me publish, but so just make sure that you're verbal and, tell them what your expectations are as well.
Any other questions, you guys?
I can start if you want. So I can guide you guys. I know for me, I start my week off by, let's say it's Friday. I actually start on Fridays. So I screen applicants, or I'm sorry, screen patients. So I get to see who's going to be in clinics. So we have clinics on Monday and then surgeries on Wednesday. So tomorrow. So for yesterday's clinic, I go on Friday. I check who's coming in. I make sure that they meet the criteria to be in our study. So for us, they have to be over like a certain age and have to have had obviously an appendectomy or practice a scopotomnus procedure or something like, or we do other procedures as well. It's not limited to that. So once I see that, I just kind of write down who they are. I approach them in clinics. I get to see parents. I get to talk to the kids. So one thing I know from Mariana, she also works in pediatrics. that we do our ascents as well. So I also like to make sure that not only is a parent agreeing to be in the study, but the child is, because this study is for the child, and I don't want to make a child uncomfortable if they don't want to be part. So even if they don't have to sign a consent form, I kind of try to read like their body language, or ask them directly, like, is this something that you want to do? Because sometimes I get parents saying yes, but the child is very insistent that they don't want to do it. And I'm going to make sure that the child is also comfortable in the study. On Wednesdays, I get to see the patients before they have surgery. So that's really exciting. Sometimes I get to go in and see the surgery. Sometimes I don't, depends on my time. But yeah, most of the time I spent also calling patients in my study. So I get to talk to patients almost every day and do surveys with them. And I really get to meet them throughout the 3 weeks, which is really nice. And I have meetings almost all day. And for you, Mariana?
So it really varies week by week, but for the most part, there will be weeks where um, all of our patients in this one study that I'm doing is we're testing Dupixent on children between the ages of 6 months to 6 years old, because Dupixent has been proven to work to alleviate eczema, severe eczema on children older than 6 years old. So now we're trying to get it FDA approved for the younger kids. So they're almost completing the study. So what this week is looking like. Monday, yesterday and today, it was really just a lot of desk work, a lot of regulatory, because I have a monitor, so a representative from the pharmaceutical company coming to look at our books to make sure that all the activities till this date have been conducted according to how the protocol states that they should be conducted. So all paperwork has to be in order. So that's what I'll do today, what I did today. And then starting Thursday and Friday, I will be seeing patients only. So I expect two of my patients to come into the clinical research unit. One of them will receive drug, and the other one is the end of the study for them. So we'll start phasing them out onto receiving the open label part of the study, which is where they're no longer receiving placebo or the drug. They will be receiving the drug only up until their insurance, until the FDA approves of the medication for their age, and until their insurance approves this medication for them. So it really just varies week by week, but that's sort of what it tends to look like. Either I'm at my desk doing regulatory work, or I'm in the clinic with the patient, making sure that they are getting the study drug, and making sure that they're completing all kinds of activities. And then in the middle of the week, I give patients a call just to make sure that that they're doing okay from the last time that we spoke to them. So just assessing their health in general. Okay, I see we have more questions. So somebody asked, they're considering having a gap year before med school, and they're also
Her question.
Sorry.
For Jesse.
Huh?
I was on mute. Sorry. So,
Oh.
so to answer your question, since you are pursuing a career in pediatric surgery, I recommend it. I know for me, when I started at Larry Children's as a coordinator, I think as a coordinator would be really, really good for your gap year. But if you still have some time till your gap year, participating in like a program where you can do research with them would also be good. I know for me, my PI is an amazing mentor, and he's not just a mentor to me, but to several students at Northwestern. And it's just, he's also a pediatric surgery professor at Northwestern. So he's been great at kind of guiding me toward that career path and teaching me the things that I need to do to get there. So I recommend it because these mentors can literally help you so much. Mm-hmm. Even today, actually, I also get to help with fellowship interviews. So once you finish your residency, after medical school, you'll do residency, and depending where you specialize, like if you want to do pediatric surgery, you'll finish your general residency in surgery, and then you'll do your fellowship in surgery. So today we had fellowship interviews for those who are going to do their last 2 years before they're official pediatric surgeons. And just being able to be there and learn from them and seeing how much Dr. Abdullah has helped a lot of these applicants get to that place was really inspiring to see. I think one of the people that interviewed was his research fellow before, and those are just people in general residency who are taking time off to do research. And it was just really interesting to see how much these people have grown in this time. And a lot of it was because they had amazing mentors like Dr. Abdullah, or we also have like Dr. Goldstein, several mentors at Larry. So it's really nice to see.
Yeah, for sure. If you have the opportunity to do something clinical during the gap year, I do recommend clinical research, just because you work with all different departments, and when you're sitting down for your medical school interview, they'll ask you like, why a doctor and why not all these other professions, and you're able to speak on that. Well, I work with this department, and I didn't really enjoy what that profession entails. So it just gives you a larger exposure to really decide that you want to go to medical school. And so what made you both decide to take gap years? Do you want to? So for me, I I didn't have enough. I had research, community research, but I didn't have any kind of clinical experience. And so I knew that even if I attempted to apply right after college, there was no way that I could really say that I wanted to be a doctor, because I had no experience. So that's one of the main reasons. And also, I was doing a lot of soul searching at that point when I graduated. I wasn't really sure that I wanted to go to medical school. So I gave myself the time to really uh, experience working in a hospital and seeing if that's something that I would want to do for the rest of my life. And so I do recommend it because it really solidified that decision for me.
Similar to Mariana, I felt like so my gap year was a little different because I did a master's program, and after that master's program, I'm taking 2 gap years before applying to medical school. So for me, or maybe longer, I don't even know. But for me, I guess I didn't feel when I graduated, I definitely did not feel like I was, I guess, number wise, GPA wise, ready or where I should have been to apply to
Mhm.
medical school. So this is why I pursued my master's. And after my master's, I also kind of didn't feel, I felt more prepared to apply, but not completely ready. And like Mariana said, I did definitely want that clinical experience to really solidify my desire to be a doctor, specifically in pediatric surgery.
Mhm.
Because before this, I wanted to do like cardio and I wanted to work with adults. And I was like, no, not kids. But I worked as a nanny for a really long time, and I loved working with kids. I worked as an early childhood education substitute teacher while I was at UIC and undergrad, and I knew that I really enjoyed working with children, and I hated doing all my clinicals that I did when I was volunteering at a hospital with adults. And I knew that I needed more experience clinically with kids. And I mean, being coordinator at Lurie really has solidified my desire that I do want to be in pediatrics, whether maybe I change my mind if it's not general surgery, maybe it's something else. But I think I do want to continue working with children.
Yeah, and then I just wanted to add if we have time. So when I was at Rush, I was working with like an elderly population, and they, for the most part, had memory issues. And so you're not only dealing with them, but you're also dealing with their adult children who have become their carers. And now in my position, I work with children, and you're dealing with the parents. And so you have these two spectrums that I don't think I would have been able to really face, maybe come my clinicals in medical school, if I hadn't had this experience beforehand. Like, I think that it teaches you, because you're in charge, you do have to do a lot of what is it, like a lot of decision making, a lot of judgment calls, and that definitely has allowed me to be more confident in what I do in my day to day. Like, if you were to push me in that kind of scenario, come and me not have this prior experience, I don't think I would have been so confident. But now, because I know that I'm able to handle it, it really adds to that maturity that medical schools will look for.
Yeah, I agree. Completely agree. It
Yeah.
definitely. And now we get research fellows who have no experience work doing IRB or anything.
Yeah.
And it's definitely a plus having this experience once you start medical school, because you will actually have to do like your own studies. I know at Rush, there's like you have
Mhm.
your own IRB. So I feel like this is really good experience because, like I mentioned, there's doctors, they've already graduated medical school who have no experience with it.
Mhm.
Unless we have other questions.
Is it like there's other options do you recommend? I'm not sure what you mean, Jesse. Do you mean like any other ways to? I'm not really sure what you mean. Oh, okay. Got it. That's okay.
Any last minute questions, comments, concerns?
Can you guys put like your emails in the chat so that like the members that like could have it right now? That would be really helpful. Oh, yeah.
Sure. So for my email, it'll be a little bit different. If you are thinking of applying to the research program, that will be to my Larry email. But if you have any like other questions, you can email my personal email, which I'll put in the chat. But for the surgical program, it comes to my regular email. I won't read it unless it's sent to my work email because that's work related.
And if you guys are thinking of applying, or maybe you need some guidance on how to apply and make sure that you are able to go through your interview well, feel free to message me. I'd be more than happy to take a look at your resume or cover letter. Yeah.
Yeah, same here. I'm more than happy. I do have a few people I've mock interviewed that got into dental school and veterinary school. So if you need any help, let me know. Oh, wait, I misspelled my email. Sorry, I don't have my glasses. They're getting fixed.
Yay.
I think that's correct.
Awesome. I think that's it, but thank you guys for coming and being so insightful with your information. I don't think there are any questions unless people want to ask before we end this.
I guess I just want to mention one more time about the program. I don't know if I might have made it clear or not clear. We're looking for any pre-med student. You can still be in college for this program. It's a pre-med research program. So you'll get to learn a lot about being a coordinator, which I think it's good experience if you're considering being a coordinator. And we just ask that it's after your sophomore year, or at least your sophomore year, so after your freshman year. I guess you have to be at least a sophomore.
So Sebastian asked a question if we knew anything related to, do we know of any clinical research related to cancer and oncology-based medicine? So I don't directly know, but if you Google like oncology clinical research coordinator positions, I'm sure a lot will populate, whether it be at Rush, Northwestern, or any of the local hospitals that are really big on research. I don't think you should have any issue finding opportunities like that.
Yeah, I know at Larry, I know this specifically because I knew someone who applied to a position like that.
Yeah.
And me and my manager were talking about it, and they said that they're at Larry, they're always looking. But I will say, because of whole COVID, it might take a while for you to hear back because of it's definitely there's a lot of hiring restrictions right now. So don't feel discouraged if you don't hear back immediately. Like it might take a few weeks or something or months, but I know that's just how I know that they're always hiring because with that particular situation for oncology.
And then sorry, Angie. So one more thing that I wanted to add. So I really, if you guys are thinking that maybe you're going to need additional classes to up your GPA, it's really good to apply to these like large hospitals, because what happens is that when you're hired as full-time, you get benefits and you're able to take classes with a tuition benefit. So if you don't want to pay out of pocket, for that post-bac or whatever it be, there's definitely opportunity for you to take classes for free or maybe at a reduced cost while you work as a full-time employee.
Yeah, for me, I get to take reduced classes at Northwestern if I wanted to.
Mhm.
I don't know if you're Northwestern, if you get it reduced or for free, but for Larry, we get them reduced at Northwestern.
Yeah. And Jesse, I went to two high schools, Hubbard, and then I transferred over to DeVry. Awesome. Any other questions? Sorry. Okay. Well, you guys have our emails. Feel free to reach out to us with any questions. I don't know a lot, but I feel that maybe if you have any questions related to what I've done or you're curious, I could probably help.
Thank you so much for having us, and I hope that we were
Mhm.
insightful and you got to learn some things from us.
All right. Thank you guys.
Yes, thank you guys for coming.
Thank you.
Thank you so much.
Of course.
Thank
Yeah,
you.
of course.
It was really nice to meet you guys.
Yay. Likewise.